Oh, what a story! What craziness this is. So masks are now driving everybody nuts. There was a This particular story is going to be about Low Key, the wrestler from Ring of Honor. Pretty pretty well known independent wrestler. He posted a statement online. Immediately got a ton of backlash. Apparently, people not only did not read it, but they didn't understand it. But this also ties into the WWE COVID situation where people continue to spread this story around that they were told that they couldn't wear masks, even though John Alba already said that, he talked to people who were there and they were not told that. Then The Rock's daughter also came out and said that it was not true, that they were not told through the PA systems that they could not wear masks and that people were wearing masks and all this shit, right? Despite all of that, mask culture is now a big deal. Now, I'm not going to go through the whole WWE stuff because, again, I went through it probably in a video. Maybe it's not even up yet. Maybe it is. Who the hell knows? But ultimately, this is about choice, right? So this is what Low Key's statement. And Low Key's statement, I think, is pretty fair. It says, respect is a two-way street. I respect your right to remain ignorant, be ruled by fear, and not by logic or intelligence. Wear a mask, quote-unquote social distance, that ultimately harms your health now and in the future, provided I do not have to pay for your bad decisions. I respect my own health enough to expose my immune system to the world by shaking hands and embracing people as we have for thousands of years to build our immune systems to fight against disease now and in the future. You have zero right to tell me that I must wear a mask, take a vaccine, or quote-unquote social distance from others who also choose not to do these things. Life is about choices, and in the information age, ignorance is a choice. I choose not to be ignorant. So Low Key put out this statement. The important part of this statement is that he says, you have no right to tell me that I must wear a mask, which I agree with. That's 100% I agree with that. Because, but this first part eventually leads to the second part, right? You cannot tell me that I have to wear a mask or take a vaccine. Okay, that should snap the light bulb. We're talking about slippery slope theory right here, right now, right? Because it starts with everybody needs to wear a mask, and then they'll immediately tell you it's not for your health, it's for the health of everyone. It's the general welfare, right? So once they start talking that general welfare stuff, we're talking about probably forced vaccines, right? Now, people will say, well, that's conspiracy theory. You're a conspiracy theorist. No, we've been arguing. How long in these United States have we been arguing about vaccinations? We've been arguing about this stuff for a long time. But the most important thing here is he said, you have no right, blankety blank, to, or from others who also choose not to do these things. In other words, it's one thing for him to say, one thing for you to make the argument that you have to wear a mask in a store. That's me. I only wear these masks and shit when I have to go to the store. Because the stores are now, everybody's listening to, Fauci or whatever. And because apparently he wasn't wrong 5 months ago. He's wrong now? Was he right? Was he wrong then or was he wrong now? We'll get into that in a minute. So apparently, this idea that he is probably being, told to hang out with other people who also don't want to wear a mask and don't want a social distance. They just kind of want to test their immune systems. And somehow this is a problem, right? And I agree with that. If two people make a decision and it's a decision they both made together, why does anyone else care? Now he sounds, he seems to be like a Trump supporter. I'm not so sure. I looked at his timeline because I had never thought to even pay attention to Low Key on Twitter. But he seemed to be a Trump supporter. And also, Lance Archer, he liked this tweet. So a lot of AEW fans are probably going to be upset. I saw quite a few of them. Now, everybody, of course, reacted the way that they react. Ryan Satin called him selfish. ProWrestling.net or whatever attacked him and started saying like, oh, well, he must be a doctor. He thinks he knows everything. So let's talk about this whole doctor that everybody keeps talking about. This Anthony Fauci. You know, what did Anthony Fauci say about masks? Back February 17th, 2020, he said, masks. Only people who need masks are those who are already infected to keep from exposing others. The masks sold at drugstores aren't even good enough to protect anyone, Fauci said. If you look at the masks that you buy in a drugstore, the leakage around that doesn't really do much to protect you, he said. People start saying, should I wear a mask? Now in the United States, there is absolutely no reason whatsoever to wear a mask. This is what he said in February. Right? Now, here's what he said in June. Okay? This is from TPM. I forget what TPM means. I took a screenshot. I didn't read it. But it had a good summary. It says, after reiterating the importance of continuing simple practices to help reduce the spread of COVID-19, which include wearing a mask, 5 months later, avoiding crowds of more than 10 people, and hand washing, Fauci added that he thinks the public can, quote unquote, seriously consider complying with those precautions as coronavirus-related restrictions are gradually lifted. Fauci went on to say that he wears masks in public because although it's, quote unquote, not 100% effective, he views the practice as, quote unquote, sort of respect for another person and have that person respect you. In other words, the masks aren't about health. They're about respect. Like pronouns, right? It's like, oh, well, it's not going to bother you just to list your pronouns. It's a control measure. It has fuck all to do with health. Okay? It's, like, maybe it does, but can you give me like a percentage of how effective it is? Is it 75%? Is it 78%? Is it 99%? Is it 98%? What is the percentage? But we can't get that answer. We were just told not too long ago that it doesn't, we don't need to wear masks. So then I get into it with the ProWrestling.net dude who lists me all the death certificate, all the deaths, the people who died from COVID, and all the people who've gotten sick or who've tested positive. By the way, tested positive does not mean that they got sick. So you have these problems here. Sometimes people get, quote unquote, asymptomatic. They don't even get a runny nose, right? So then I get bludgeoned over the head with how many people died, but they don't understand that those death numbers are inflated. How are they inflated? Here's the National Center for Health Statistics. Here's what they say. COVID-19 deaths are identified using a new ICD-10 code. When COVID-19 is reported as a cause of death, or when it is listed as quote-unquote probable or quote-unquote presumed cause, the death is coded as U07.1. This can include cases with or without laboratory confirmation. In other words, we're just taking the doctor's word for it. So if the doctors put that you died of COVID, then you died of COVID, even if you didn't. Even if you didn't. Okay? Furthermore, let's keep going a little bit more on this whole COVID death thing. So the CDC, a confirmed case or death is defined by meeting confirmatory laboratory evidence for COVID-19. In other words, the only way we can know somebody truly died of COVID is for them to have a confirmatory laboratory evidence. But the death certificates or the death rates that you are told on TV include probable cause. Okay, what is probable cause? A probable cause or death is defined by one of the following: meeting clinical criteria and epidemiologic evidence with no confirmatory laboratory testing performed. Okay, meeting presumptive laboratory evidence and either clinical criteria or epidemiological evidence. Meeting vital records criteria with no confirmatory laboratory testing performed. Okay, so this is how they're getting to this number that they keep shoving around on TV of how many people died of COVID, right? They're just looking at what for starters, like crime statistics, they don't know for sure who died of COVID. They're looking at what the hospitals are telling them, and the hospitals could be telling them anything. So are the hospitals incentivized to lie to get more money? Yes, they are. Okay. There's plenty of information out there where you can look and you can find that hospitals are indeed being, they're called, what is this, high impact distributions from the government. If you have a high rate of COVID-19 positive cases and deaths, you get more money from the government. This stuff is true. Okay. So, but all of this is about mask culture, right? Everybody wants you to wear a mask, but it's not about whether the mask is effective or not, whether the mask actually works or not. They're also not talking about liberties, which is the important thing here, because we're often people, when we're talking about these things like masks and shit, we're talking about people's liberties. Can the government force me to wear a mask? The answer is no. But when you see people getting mobbed in Trader Joe's and all that type of stuff because they won't wear a mask, that's a private business who are saying, hey, we want people to wear masks and to social distance or whatever. But, and they have a right to do that. But I'm talking specifically about the government and this social culture of we're going to police whether people are wearing masks or not. I see people all the time not wearing masks. I don't care. I only wear a mask, again, I have to, in order to go into some of these shops, to go and get like a loaf of bread. They want you to wear a mask, whatever. Okay. But that's the thing. Like we're told that it's a minor inconvenience, right? It's a minor inconvenience. It's a small thing that to promote goodwill amongst everybody and the general welfare of your brother man, your fellow man. It's bullshit. Okay. We're going right back on the slippery slope. Right back. Okay. We're right back on it. It won't be long before they start mandating vaccines. And you can call me a conspiracy theorist if you want. They ain't got a vaccine yet. Okay. But one is coming. So, and for me, it's not about whether you agree to wear masks or not. I don't care. I don't care about people wearing masks. It doesn't make that big of a deal to me. But people who are mobbing low key are not reading and not doing things for themselves. At least he's thinking for himself in these instances. So when you say that he's being stupid or whatever all these people are saying, are you really, how sure are you that he is being stupid? The people that you're relying on are the people who were wrong 4 months ago. I mean, you can't be upset for people who don't who don't respect people who were outwardly wrong. And I was told, well, maybe they just learned more. It's like, maybe you shouldn't be giving the public information if you don't know what's going on. Okay. That's the government, but the government is ineffective. This is just government being government, dog. They have the power to tell people what to do. And so they're going to do it. Rightly or wrongly, they're just going to do it. But let me know what y'all think in the comment section. What you think about Low Key and his opinion on masks. And I again, I'm just going to throw my hands up. It's just sad that we see that we're back, after a month of people being outside, coughing and sneezing on top of each other, getting into fights, going inside of riots and shit. All of a sudden, we're back to caring about whether people wear masks or not. It's all fake. It's phony. It's fugazi. All right. This is bullshit. Let me know what you think in the comment section. I'll talk to you guys later.